Thank you so much, Elaine, for the lovely welcome, and also for hosting us today in this really prestigious and beautiful venue. So today is a really important day. It's an important day for us to come together and reflect as a movement on the incredible progress that we've made. But it's easy to forget that we were the first across the world to introduce social prescribing as a core element of healthcare in this country. This is the biggest investment in social prescribing by any national health system and legitimises non-medical community-based activities and holistic support alongside medical treatment. That's a hugely innovative, ambitious and pioneering step forward that was made back in 2019, and it was unique. Back then, the ambition was for 900,000 people to access social prescribing in their GP practice by 2024. So where are we? 1.6 million people have been referred to social prescribing link workers in primary care alone in that time. So we're on track to double the target. What that shows is there is incredible demand, both from patients and from GPs. But there is so much more to be done. We all know we're in an epidemic of loneliness, of disconnection, of physical inactivity, with all of the health problems that that brings. And the traditional medical system is really struggling to cope. So we have to address the root causes, and we have to make social prescribing a central response. The National Academy for Social Prescribing was also formed in 2019. And in that time, we've made huge progress developing and delivering a range of really successful programs regionally, nationally, and globally. But social prescribing is in its infancy, and there is so much more that it can do. So I'm really pleased today to highlight some of the key priorities in our new strategy. Connection. For social prescribing to be effective and for it to be inclusive, we have to build a robust infrastructure that links social prescribing better to healthcare and also better to the voluntary and community sector. We have to build new networks. We have to identify innovation and share and promote that innovation so that it's embedded, and build robust pathways so that every single patient is asked, what matters to you? And can access community support alongside their medical care. Investment. For social prescribing to be effective and really inclusive, we have to build the case for more investment into community activities and the voluntary sector. 5% of the NHS budget is spent on prevention, and a tiny proportion of that will go directly into community activities. Yet we know this investment pays dividends. If you look at the outcomes from our Thriving Communities programme, you'll see the benefits to people and communities, to health and well-being. So we have to work not just with government and with new NHS organisations like the local integrated care boards to argue for that sustainable investment into local communities, but we also need to work with the private sector, with philanthropists, foundations, trusts, to develop new channels for that investment to flow into community organisations, particularly community organisations working in deprived communities or encouraging and promoting diversity and inclusion. But key to all of this is our most important priority, and that is investment. Sorry, evidence. Come on, slides. That is evidence. So we won't secure this investment in community services. And in fact, some investment in community services is actually being jeopardized at the moment with the financial pressures that we're under. So in order to secure that sustainable investment, we need the most robust evidence that those community activities are making a contribution to people's health and well-being. But also, we won't see social prescribing properly integrated with medical care unless everybody truly believes that it works. We're making great strides with this already. So NASP is working with leading academics and experts around the world to build the evidence base. But still, I'm regularly challenged that the evidence isn't sufficient to justify the investment. So I'd like to look at this for a moment. I'd like to tell you about a scheme that I developed in Kent. This was a social prescribing link worker scheme. It was initially funded by the Department of Health as a pilot. In the end of 2019, we were challenged by the local NHS to prove that the pilot reduced demand on NHS care in order to secure ongoing funding. It was challenging, it was complex, but we did it. We got the data and we showed that for the patients supported, their A&E attendances reduced by 13%, their unplanned hospital admissions by 12%. Then again, the challenge. It was a small cohort, it was a pilot, it was only in 5 GP practices. We need more evidence. So this month, we ran the data for 6,000 patients that we've supported with social prescribing. This showed a 20% reduction in A&E attendances. Here's some data here. For the frail elderly cohort, it was 23% reduction in A&E attendances. It's important to remember that this scheme is not connected to a hospital. It's a community-based social prescribing scheme. Imagine what we could do with a team of link workers in every A&E. That's the thing about social prescribing evidence. The more scrutiny you put on it, the harder you look, the better it gets. So I call for the highest standards of evidence and research, randomized controlled trials, economic analysis, so that nobody can doubt social prescribing is not a really important part of our healthcare. The reason we're doing all of this is simple, so that more people can benefit. There we are. So that's our other priority, to raise awareness. We've got to make sure that more people understand social prescribing and know how to access it. So we need to build knowledge, we need to share knowledge, and we need to promote social prescribing, but with clarity, focus, and consistency. And that's why we're all here today on National Social Prescribing Day. So at NASP, we're really excited about what the future holds for social prescribing. We're really grateful to the Department of Health and Social Care for their support, and all of our partners, and all of you here today, part of the movement working on this with us together.